Hi there and welcome back. Let's review brain aneurysm today. A brain aneurysm, also referred to as a cerebral aneurysm or intracranial aneurysm, is a weak bulging spot on the wall of a brain artery, very much like a thin balloon or weak spot on an inner tube. Over time, the blood flow within the artery pounds against the thinned portion of the wall and aneurysms form silently from wear and tear on the arteries. As the artery wall becomes gradually thinner from the dilation, the blood flow causes the weakened wall to swell outward. This pressure may cause the aneurysm to rupture and allow blood to escape into the space around the brain. A ruptured brain aneurysm commonly requires advanced surgical treatment. Saccular and fusiform aneurysms are the most common type that you will see in the medical records. The saccular aneurysm is the most common type of the aneurysm and it accounts for 80 to 90% of all intracranial aneurysms and are the most common cause of non-traumatic subarachnoid hemorrhage. It is also known as a berry aneurysm because of its shape. The berry aneurysm looks like a sac or a berry forming at the bifurcation or the Y segment of arteries. It has a neck and stem. These small berry-like projections occur at arterial bifurcations and branches of the large arteries at the base of the brain, known as the circle of Willis. The fusiform aneurysm, on the other hand, is a less common type of aneurysm. It looks like an outpouching of an arterial wall on both sides of the artery or like a blood vessel that is expanded in all directions. The fusiform aneurysm does not have a stem and it seldom ruptures. So that's the difference. Statistics. An estimated 6 million people in the United States have an unruptured brain aneurysm, or 1 in 50 people. There are almost 500,000 deaths worldwide each year caused by brain aneurysms, and half of the victims are younger than 50. Ruptured brain aneurysms account for 3 to 5% of all new strokes. Women more than men suffer from the brain aneurysms at a ratio of 3 to 2. Another interesting statistic, 4 out of 7 people who recover from a ruptured brain aneurysm will have disabilities. So what are the risk factors? Hypertension, smoking, family history of brain aneurysms, traumatic head injury, infection, drug use, particularly cocaine, tumors, and last but not the least, age over 40 are considered as common risk factors. What are the warning signs and symptoms? If ruptured, blurred or double vision, localized headache, pain above and behind eye, dilated pupils, weakness and numbness, and difficulty speaking. That is if unruptured. If ruptured, then brain aneurysms usually result in a subarachnoid hemorrhage, which is defined as bleeding into the subarachnoid space. When blood escapes into the space around the brain, it can cause sudden symptoms like sudden severe headache, nausea or vomiting, seizure, sudden trouble walking or dizziness, loss of consciousness, stiff neck, sudden blurred or double vision. So depending upon if ruptured or if unruptured, we could have all these warning signs and symptoms. So how do we diagnose? Through imaging screening techniques, individuals at high risk of harboring a brain aneurysm can be identified easily with non-invasive imaging tests. Some methods include CT scan, CTA, MRI, and MRA. How do we treat brain aneurysms? If an aneurysm is detected but has not ruptured, there are more options, either treatment or observation. Once an aneurysm has already ruptured, the options are either open surgery or an endovascular approach. Either is recommended to be performed as early as possible after hemorrhage to prevent rebleed of the aneurysm. The goal of either treatment is to prevent rebleeding by sealing off the aneurysm so that the aneurysm is totally obliterated with either a clip or coil. Doctors consider several factors when deciding which treatment option is best for the particular patient. Some factors include patient's age, size of the aneurysm, and location of the aneurysm. Okay, so what it boils down to when we talk about underwriting, follow your company specifics, internal guidelines, and the underwriting manual that your company expects you to follow. Okay, let's take a break here and see you soon. Take care. Bye now.